it's gonna change.
All right, it is 10 o'clock in the morning. We will call Courts and Public Safety Committee to order. Could I have a roll call, please?
Mr. Erickson,
Here.
Mr. Morris,
Here.
Mr. Hardy,
Here.
Mr. Walker,
Here.
Mr. Beggs.
Here. Let's see, I'll entertain a motion to approve minutes from the October 12th, 2023 meeting.
I'll do that, Morris.
Support Walker.
Motion and support, any discussion? All those in favor of approving, say aye.
Aye.
Opposed, the same. Very good. Any changes to the agenda? With that, I'll entertain a motion to approve the agenda.
Make that motion, Hardy.
Support.
Erickson, support. All in favor, say aye.
Aye.
Opposed, the same. Very good. Any public comment for Courts of Public Safety? All right, thank you for joining us. Jim, looks like you're probably here in place of Jeff.
I am.
All right, we have EMS, Life EMS third quarter report.
Great. Good to know just about everyone here. I'm Jim Harriman. I work closely with Jeff Stockdale, Deputy Director of Northern Operations. Jeff is on vacation right now out deer hunting this morning, so good pleasure of giving a report today. So for the third quarter, we saw 716 transports and assessments, which was a little bit of an increase over last year's increase of 55 over the same time period last year. It's a little bit busier. 355 of those were priority 1 or med 1s, which is our highest priority medical call. So quite a few of those. Leaving us at 87% compliance on our priority 1 responses. Didn't quite hit that 90% target that we would like to see. I dug into that quite a bit. I would say there's a couple of factors come into play. One is we were busier. The other is Silver Lake Sand Dunes. It's only 9.8 miles, I believe. We just cannot make that in the 15-minute time frame. There's just no straight shot out here. So I see quite a few of those responses as missed responses just because of the location of that.
And probably have your traffic once you start doing the Silver Lake proper.
Yeah, that's a big part of it also. That was the best I could come up with digging into the data though, just trying to understand it and see where we can, areas that we can improve on. So. In addition to that, I'd like to touch on a couple of things. One is behavioral health transports. That's a new program Life EMS kind of pioneered about a year ago we started. And what that is we have a lot of mental health transports or behavioral health patients that need to be transported from hospitals to other facilities. What we're seeing is a lot of those patients are going a very long distance. There's quite a few trips to Indiana, Detroit, Lansing, so it ties up an ambulance for a very long period of time and taking them out of this area, which we don't like. So we started this program about a year ago, and what it is we have basically a Ford Escape that we've outfitted similar to a police vehicle. There's a screen between the driver and the passenger in the back seat for safety reasons. And then there's a TV to keep them entertained or occupied. It's a pretty nice setup. And for patients that don't have the medical need but have that mental health need, we're able to take them in this vehicle. One of the nice things is it doesn't require an EMT or a paramedic to do that. We have people that are trained in mental health training, which helps to transport these patients. That program has really expanded over the last year. We're up to 5 vehicles dedicated to that, and we have 2 more being built right now. It's been really successful. They're based out of Grand Rapids and Kalamazoo, but they're coming up to our northern area to take these transfers. They're responding company-wide. They look at the schedule in the morning, and they come up with a schedule and deploy those units accordingly. So we're really excited about that. We predict that it'll keep our ambulances, in the local area for longer periods of time for 911 responses, which should tie into response times as well. So it's something I'm really excited about. I see them come up here a lot. Our goal is by early next year to have all of those patients go only by this method. Right now, we still take a few by ambulance if scheduling and staffing things come into play, but our goal is early next year to only use those units. So pretty excited about that. It's a neat program. Jeff and I sit on the West Michigan Regional Protocol Group, so that we develop medical protocols and treatment protocols. Keep an eye on that. That group is comprised of a pretty big area, so we meet with physicians and EMS directors from other agencies. We develop those protocols. The state of Michigan actually adopts a lot of the protocols that this group develops, which is pretty neat. So with that being said, there's been a lot of changes coming up in those protocols. Nothing major, but just a lot of little changes that we anticipate seeing going into effect around February. So Life EMS is currently working with our education department to develop a training program to get everyone up to speed and get all our folks up to speed on that. We're doing kind of a combination of an online training that they can log in and do when they're available to do that, and then also an in-person. And we'll tie some continuing education credits so they get some benefit that way too. Not a whole lot of events to report on. We did do a standby for the Silver Lake Apple and Barbecue Festival, and then we had kind of an unusual request from the Ford Motor Company. They were filming a commercial in Oceana County this summer, and they requested our presence for medical standby while they were filming that. So a neat opportunity. We were able to pull in extra staffing, you know, to cover that event. Kind of a neat request, I guess. So haven't seen the commercial yet, but kind of unusual. We had 9 fire standbys during that time period also. And then there's one other thing, it's not on the report, but I'd like to touch on it because it's important to me, and I think it's good for you guys to hear. With the staffing shortages we saw through COVID, our kind of what we focused on was education is key to staffing. And that's a huge part of keeping our ambulances staffed and getting new people trained and getting younger people into the field. So we've really focused on that. We just ran an academy style, and I guess I should start by saying we don't want to compete with West Shore College. We have a partnership with them and we work together. But Life EMS offers a 12-week academy style program for people to become an EMT. It's different than the traditional college semester, so there's a lot of students that kind of fall out of that college setting that want to go to our academies, and that's why I say we're not competing. We're trying to catch those students that don't want to go to the traditional college setting. So we just had a graduation from our Fremont one, and I think we graduated 13 people. This is our second academy there. Our first academy there, I think we had maybe 5 people enrolled, 5 or 6, not a lot. I think word's getting out because we had a full class, so I was really happy about that. And one of the reasons I bring that up is we had that academy here, and I think we only had maybe 4 people enrolled in that. It was kind of similar to Fremont. It was a small enrollment that first time around. I've been talking with our director of education. I would like, and I can't promise it'll happen, a lot of things have to fall into place, but I would like to offer that academy here again in Hart, hopefully in the spring. If you guys are okay with that and allow us to use the county services building. Again, I have to find an instructor. There's things that have to fall into place, but that's my goal, is to try to get one here again. I did attend a career day at West Shore College. It was high schools, a lot of seniors and juniors. I think there were several thousand came through. It covered a huge area. And that was one of the things I kind of asked students about. Hey, if we offered an academy in Hart for some of the local ones, would you be interested? And I had quite a few say, yeah, I would be interested in that. One of them told me the college schedule just didn't work with her schedule, but this probably would. So I said, I'm really trying to get some word out there and get some feelers out for the enrollment side and trying to put that together. And I'm hopeful it's not set in stone yet, but I just want to let you know that's something I'm working on. So I'm excited about that. And I think that's about it for my report. Is there any questions or anything I can try to answer for you?
Tim, just a couple comments. Jim, thank you for being here.
Mm-hmm.
Thank you for the
Happy
report.
to do it.
Your progressive steps on the transport of the mentally, people. Have you considered at all going to one of the West Michigan Community Mental Health Board meetings? When you get close to that, and explaining to that board how this is actually going to work. I think, if you explain it to them instead of them hearing it through the grapevines and everything, it'll probably set a lot better. I sit on that board presently, okay. So it'd probably set a lot better with them. How it's actually going to work with the board. They probably have nothing to say about it, but having been through a couple rocky roads on different things in the past, maybe if we get them up to steam.
I'm not familiar with that board. Maybe I can get with you after the meeting to get some information.
Yeah.
Myself or Jeff would be happy to attend one of their meetings if they could put us on the agenda and kind of give a presentation.
West Michigan Community Mental Health in the office is at 906 Diana Street in Ludington.
Okay, yep.
and I can get you more information on it.
Yeah, I'd be happy to, or Jeff.
You know,
I'd be happy.
I just think, you know, to go in there ahead of time, just to let them know how it's being done would probably set a lot easier,
Sure.
you know. And you talked about the Ford Motor Company.
Mhm.
I don't know if you're aware, but the vice president of the transfer line for the F-150s has a home on North Lake Shore Drive over to Silver Lake.
Oh, okay, I wasn't aware of that.
Yeah.
That kind of
Yeah,
explains.
so there may be something with why that there. I remember back being with Pete Lundberg when General Dynamics had the Humvees out there and they were running them up the sand dune. They were looking at the turbocharged diesels and the non-turbocharged diesels. So what a difference sitting at Test Hill and watching them trying to get up there. So, and
Local connection.
at that time, these commercial entities like that paid very, very dearly to the state of Michigan to be able to use those sand dunes for their testing. And I wouldn't be surprised they still do.
Yeah, they probably do.
Pretty cool when they do those things out there.
Mm-hmm.
Paul, you have something?
Yeah, Jim, how about the M20 barn? Is there any movement on that?
It's not moving as fast as I would like. There is movement on it though. Jeff and I actually just saw the blueprints for that station and we reviewed those, made a few suggested changes. We're waiting to see those come back to us again. I just talked with Mark about that about a month ago, and he was trying to get a contractor lined up to start on that this fall. He said it was most likely gonna be in the spring, just by the contractor's schedules and what he can put together. He said if he can make it work this fall, he was gonna try to do that, but he said contractors are busy and trying to get on their schedule is tough right now, so he said most likely in the spring. We do own the property, the blueprints are real close to being done, so it's moving forward. I wish it was already here, you know, just honestly, it doesn't seem to be moving as fast as I'd like, but that's where we're at with it. There is movement on it.
And also, I might add that in Colfax Township, if you'll recall, they built a fire barn. They built a new building, they built a fire barn. There's 2 doors in Colfax, shower facilities, everything was there for a fire department. That idea has since been abandoned. They sold the trucks they had. There is a barn in Colfax on Jackson Road that has 2 open bays with showering facilities, bathrooms. So you might want to speak with Dave out at Colfax and see if there's a possibility, if it fit into your world, you know, maybe it's a place that you guys could use for a pit stop.
Yeah, that's a good thought. I'll look into that. Appreciate it.
Bill?
So hard numbers here. Hey Jim, by the way. Some hard numbers, last year, 2022, same quarter. It was, 77 responses in about 15 minutes. This quarter was 63. So it's a nice, nice improvement. Glad to see that. And then the other, where was the commercial shot? Was it at the sand dunes?
It was on the beach area. I don't remember the exact location, but yeah, it was on the Dune beach area. I thought that was really neat. I've never had a request like that. I've been at this about 30 years. That was just neat. You know, it'd be neat to see a commercial, the local tie. And,
Sure. If it's like any, so I was a part of a Nike commercial. I'm not trying to, I just was. And it will be like a 30-second commercial and it will be 2 seconds of that whole day that you're a part of. There's 2 seconds of it. So that might be the same.
It'll just be the back of your head too, right?
Right. I wasn't in it. I never ended up in it.
Hey, that 2 seconds would be nice if it had Oceanaconia, Michigan down on
That's
the
right.
bottom of it.
Absolutely.
Not on a Nike commercial.
Right.
I would just comment, I think the mental health transport is really a win for everybody. I mean, obviously taking an ALS unit off the road to transport a non-medical, it's financially more feasible for you guys to outfit something like that than an ambulance. It's more economical to run, and it keeps our ambulances in county. So I applaud that effort and that continued expansion. I think that the transports, we saw transports are taking a lot of equipment outside. You know, granted, some of them are medical and our own people that need transport, so there's a reasonable expectation there, but this is a great step, thinking outside the box to, and it benefits Life EMS as well financially. Just because you don't have a $200,000 ambulance making a trip to Indiana with two EMTs in it. So,
Yeah, it's actually financially, it's a bit of a struggle.
Is it?
Because if we take an ambulance, we can bill insurance for that.
Oh.
Insurance will not reimburse us currently for these, transports that we're doing with Ford Escapes. We're actually eating the cost on
Really?
that. It's a costly program, but that being said, is we are lobbying with the state of Michigan and lobbying with insurance companies, Priority Health, to set up a system where we will be reimbursed for that, in the future. You know, that's what's good, we'll keep it sustainable. But I mean, if we're willing to meet that cost initially, get the program up and running and show that it's successful.
Prove that it works, yeah.
So that's kind of our thought on
Well,
it.
good. Even more applause than to take that step and push forward with that.
It's just huge to keep our ambulances here. You know, we see somebody to Indiana and you're looking at an 8-hour trip a lot of times by the time you get down there and give a report and get fuel. That's a long time to pull an ambulance out of the area when it isn't medically necessary.
Tim?
It's necessary, just not medically.
When I first read that, being close to the golden years, I remember when all of those transports were done by law enforcement people. And we certainly don't want, I don't think Undersheriff Schiller wants to get back into that, you know, again, but it certainly was
They still
not.
do.
Yeah, I was gonna say, law enforcement
Some.
will still have to do some, if, you know, they're violent, there's safety concerns, things like that we can't safely do them, then law enforcement does come in, but hopefully this will take some of their workload away.
We used to do just about all of them at one time.
Yeah, hopefully Ryan has seen an impact of that, or will soon.
Yeah, as long as, anytime the court's involved or there's a court order involved, which is what ties both of our hands. So,
Good. Any other questions, comments?
Well, and I'm happy that's happening because with the millage and as taxpayers, we are subsidizing private business to utilize our buses for transports. That's been the biggest concern I've heard from people is, why are we subsidizing hospitals and the healthcare, transferring patients when we might really need them on the dunes, or we may need them, you know, for an incident in our county and they're out of town. You know, it's best to leave our 3 buses where they are.
And that's our goal. It's a struggle because these transfers, a lot of them are a local resident where they don't have the specialty services here. If you need a cardiologist, it's just too small of an area to support a full-time cardiologist. So a lot of times it's a local resident having a heart attack that needs that special service. So we do need to get them to that destination. You know, but at the same time, yeah, it removes from our 911 response. So it's a balancing act, honestly.
Anything else?
Thank you, Jim.
Thank you.
Thank you, appreciate you giving me the time. Feel free to reach out at any time to myself or John.
So-
If you come up with questions later on, please reach out.
Oh, one thing I was gonna mention, your class, I'm sure I can speak for the board, that if you get something lined up, we will make every effort to accommodate.
I really appreciate that. I do. It means a lot to have that county services building available. It's a great location for classes. So I can't promise it yet, but it's being worked on. I'm trying my best to pull that together.
So can I text Jeff about 3 or 4 times a day when he's stalking an animal?
Morning and evening would be great.
Not during daylight.
He just might reply when he gets up in the morning, though.
Thank you.
Thank you.
Any reports from department heads?
Good morning.
Good morning.
Just an update on the hazard mitigation plan stuff. Kudos to all you guys who reached out to your affiliates, townships and cities. And as of yesterday afternoon at 2:18, we have everybody but Village of Hesperia, Village of Walkerville, and Weir Township have all signed on and are all good to go. So those are being worked on, and thank you to the MTA because Raphael helped out quite a bit with that, reaching out and trying to get participation from 100%. it's not mandatory that any of them have to come in, there's no rules, so your plan is not subject to them, any of them being part of it, it's your plan. But that's pretty impressive, because looking at the history that we were going on, from that we were missing quite a bit, so that's worked out well, but thank you for reaching out to those places. So if you could reach out there and try to get them to get hold of Stefan, and then we can try to get everybody on board. But even if we don't, that's still a huge percentage, so thank you for that help. Any questions on that?
Did we get Greenwood?
Yes.
So we've got everybody.
Just, yeah, the only thing we're missing is Newfield, Newfield Township, Village of Walkerville, Weir, and the Village of Hesperia.
Newfield's been notified, and I know Weir's gonna make that decision next week, and Village of Walkerville, I'm surprised at that, so.
Well, they'll have to adopt two plans, cause it's split,
Yes.
so that's where they're at.
Village of Hesperia has been contacted too, and just, said they do it, just a matter of doing it.
They've all been contacted, every one of them. There was emails, phone calls, and certified letters that Windsor sent out, so everybody had been contacted. So there was no lack of contact, it was a matter of trying to get them to participate, because in years past, all they do is say in an email saying, yep, we're in, and they were done. Well, the government changed the rules on that, and they have to have more input and review and have a conversation at least and document it, that they understand more what that program means, so.
And for whatever it's worth, I talked to a handful of entity leaders, and a lot of them said, oh, I didn't know about it. And I know you guys did your due diligence, somehow though it's not getting to them. I don't know what in their hands or whatever, or they thought it was some sort of spam or spoof or whatever, which I don't.
There were literally letters that went to their offices too, so we can reach out more next time. We got a few years on that, but to reach out and try to get there. And part of what some people confuse it is, well, if we're not part of this plan, we won't get any FEMA response. That's not what it's about. It's about the hazard mitigation part of it, being available to have the funds for the hazard mitigation projects. So, but we'll reach out and try to do more with that. On that. Plus, we had all the public forums there listed in the papers. We had multiple public open meetings, hearings where we reviewed the process. So it was.
Yeah, please don't take what I said as you guys didn't do your due diligence. It just. Yeah.
Well, what happens is it comes in my mailbox, and whoever gets the mail, if they don't do something with it, it goes into file 13 or it gets lost in the
Well,
shelf.
part of the struggle is some of these places, you don't even know when the meetings are. You can't find where they're posted. They don't answer emails. They don't have an email. It's like, oh my goodness. Well, come on, people.
Welcome.
So we can only hold their hands so far, right? But it's also not mandatory that they be part of it. So there's some honest has to go back on them that they're not interested. That really doesn't have a whole lot of effect on what we do as a county. Other than that, this update, Heartfire is in the final process of getting their MFR certification. They got all their paperwork all approved. They just are waiting on the state to come inspect the rescue vehicle. So other than that, that could happen anytime. Who knows of that, but that'll be coming up, so that Hart will be the last. They're only gonna run priority ones, but they will be the last, and everybody in the county will be on the MFR program that's established. Any questions?
I would like to piggyback on the hazard mitigation plan. We received a letter yesterday via email, and I forwarded a copy of that to all of you. The hazard mitigation plan was initially slated for us to have that adopted by December 15th. However, we received a letter from Aaron with Windsor Neck stating that it's going to take a while for MSP and FEMA to get their reviews done, so they're asking us to either adopt it now and just wait until MSP and FEMA get with us, or delay that adoption. And my recommendation to you is just delay the adoption until we hear back from MSP and FEMA. You won't need to make any motions on that or anything. We'll just be holding off on the adoption of the hazard mitigation plan.
It seems to be a 50-50 split whether counties decide to move forward and adopt it. You could adopt it as written, but if they come back with corrections, then you gotta go in and make an amendment to that, so it'll be back on your table. That's where it's at. So listen to different counties, some are going to adopt anyways, because they're like, we're waiting on the state. The state hasn't even looked at lakes and basins, and those got submitted before ours, and they're just way behind.
And they reached out to me yesterday, Mason and Lake did, and asked what we were going to be doing.
Right.
Because their plan was that they will be, holding off until they hear from MSP and FEMA.
Yeah, the question was, are we still covered under our previous plan? And it sounded like that was, but no one saw that in writing, but the answer from Winter is we're good because we're not the ones late in the process. So we've submitted, we met the deadlines, in fact, we're ahead of the deadline. So our part has been taken care of, so now it's back on the state and feds.
Is the approval, is us approving, is that a public hearing, all the bells and whistles, or is it just a motion and we approve it?
The public hearings are done, just the motions of you guys approving it done. I mean, you can approve it, there's nothing wrong with that, it just means that if the feds come back, state and or feds come back and say, hey, we gotta make these amendments to it, then we make the amendments and then you have to ratify your decision again.
Tim, the problem that I have doing that, when there may be amendments, is when this comes up for renewal or 10 or 15 years down the line, when none of us are here anymore, what happens if somebody pulls that approved one out without the amendments, without the changes? It's so much better if it's only approved once, and then there's no picking out the wrong one or pulling the wrong one.
Yeah, I suppose what the administrator is saying is just wait until the one stop, be done when it's a clean document, and you're just not even about that was a question. They said, sure, you got a clean document. Anything else? Thank you.
Thanks, Troy.
Any other department heads?
I have one additional thing.
Yeah.
I was meant to say while Jim was up here, Shelby Township did an informal survey about who gets to the scene first between MFR and the ambulance. And 67, 2/3 of the time, the ambulance gets there first before MFR, which I thought was a pretty good percentage. And if it was a tie, it went to the ambulance. So you can tell Jeff that too. But informal survey, but they wanted to keep track.
Both as the delay between your paid on call firefighters have to leave their home, their business, to get to the station, to get the rescue to leave, or they're already full-time and staffed and ready to go. So you're seeing a significant delay in response when it comes to volunteers.
Or, Paul?
Unless you're out in Walkerville, which Walkerville's our first MFR department, and we realize how important it is out in Colfax. Walkerville, Ruby Creek, where we overlap with Lake, you know, I know it's no man's land out there, so we're fortunate to have the MFRs. And in the summer, I know this heart group, they are the fastest bunch of guys going, and with the busiest dunes in the world, it's so good to have Dwight and his company ready, you know, to help back us up in a summer busy season.
Firefighter will not be going on doing calls.
But just one, but the priority ones, and you know, I know how long I waited for an ambulance for my mother in downtown Hart, so I like it. Schiller can be there, you can run 3 blocks and we're covered.
All right, anything else from commissioners? Any public comment? Hearing none, we will adjourn course of public safety.
Paul, do you have any rejection or any problems with me forwarding that email on to him?
No,
Okay.
Mr. Tiffany?
Yes, I'll CC you as well.
Yeah, he is on site today, that's why I was.
Are you good, Amy? Ms. Anderson? Maybe I'll rephrase, are you ready?
Yeah.
We know you're good.
Yep.
Okay. All right, I'd like to call to order the Personnel and Health and Human Services Committee meeting. Can we get a roll call, please?
Mr. Erickson?
Here.
Mr. Beggs?
Here.
Mr. Hardy?
Here.
Mr. Walker?
Here.
Mr. Morse?
Here. Can I entertain a motion to have the minutes from the February 9th, 2023 Personnel and Health and Human Services Committee meeting.
So moved, Walker.
I'll support.
February 9th, is that the right date?
Yeah, it's been a
Yeah,
while.
we haven't had a personnel meeting in a
Oh.
For a
while.
while.
How about that?
All right, thank you, Mr. Walker and Mr. Hardy. All in favor, say aye.
Aye.
Opposed, the same, and motion carries. Any suggested changes to the agenda? Being none, can I entertain a motion to approve the agenda as written?
Make a motion to approve.
Support.
All right, Mr. Beggs and Mr. Walker, thank you. All in favor, say aye.
Aye.
Opposed, same. Motion carries. Public comment. Being none, we have two special guests here today that are going to be interviewed by our group for the appointment for the Department of Health and Human Services Board, Oceana County Medical Care Facility to a 3-year term from October 1 of 2023 to September 30 of 2026, and that is Ms. Christine Jensen and Mr. Dale Daines. You have before you, thank you again, Ms. Biard, for providing these. Some interview questions, board members. So I don't want to monopolize the questions. So feel free to ask any question at any time that you'd like to ask. Our interviews. How long does the interview usually last? Typically,
We used to have a 10-minute limit on it.
Okay, because I thought there was a limit to that. So maybe we'll try to keep it to 10 minutes. And then, but if we have, of course, if we have more questions, then we can have some leeway there. So, Ms. Jensen, just because you're first on our list, do you want to come on up? Thank you for being here.
Good morning.
So, most basic question, I think, about this idea here that you want to be appointed to this board is, why are you interested in joining this committee?
Because it's part of our community. I'm able to help. I have family that has been in the medical care, very familiar with it, and I realize its importance in Oceana County. And I've had some very nice comments from people outside the county that they hear about how excellent that the care is here. And I think that's very important to have a very good reputation.
So what do you bring as with your experiences and your skills? Wow.
I will not be responsible for that.
That's crazy.
Full of coffee grounds.
No, I wasn't.
So what do you bring to the table as far as that would benefit the skills and the experiences?
I believe that I am perfectly capable of taking information that's offered by each of the committees and parts of the medical care facility, and to oversee, not that my expertise is not in medicine, but it is certainly communication with people, and it's also I'm capable of listening to presentations and determining whether or not those things that are offered by the administration are reasonable or something that the medical training. I also have a degree initially in communication arts, and a doctorate from Western in the areas of organizational and leadership.
So Ms. Jensen, or Dr. Jensen, you were, on the board before already, correct? So I'm gonna go a little off script. Is there any, what memories, what things stand out to you? What decisions do you feel like were really hard decisions that maybe met a lot of resistance that, you know?
The most current one is the air filtration system that oversees the people that are entering, and it cleans bacteria. And there was some controversy. Some people didn't understand the science behind it, and there were several meetings to accommodate their questions. And I personally do not understand, or could I explain the chemical chemistry behind it, but I do understand what the effect is, and it's very good for people in the facility, because those coming in bring a lot of infection. We are hope to mitigate that.
And how do you handle those sorts of things?
I went to the meetings that were held to determine the tenor of the community and people that work there. Some were not happy about it, but I don't think that they were listening to the science. They had there was some misunderstandings of what the actual effect of the system was. It's quite advanced. So that was the most recent controversy. And there is another one that was quite that controversial and quite a bit of time.
Mr. Jensen, how long have you served on the board?
I came in the middle of Gail Horner's I think it's 6 years.
Okay.
Roughly,
Okay.
yeah.
Okay.
6 of it, maybe a bit.
Sure.
What do you think is the most pressing issue that our medical care facility faces, and how would you contribute to addressing it?
Stretching dollars is no different than anybody's home. It's trying to get the biggest bang for your buck. And I know that our dietary system is it's one of the most important things. If you have to be in a hospital, you really, or in that set, you want to have decent food. And the meals I've seen that have been served were very attractive and appropriate for the seasonal vegetables. So my brother was most recently in there for a period of time, so I would see his lunches often.
Okay. Now, as a committee member, are there any certain initiatives that you introduced that you want to hang your hat on and kind of maybe brag about a little bit right now?
No, that's not our responsibility. Our responsibility is to listen to what's brought to us and evaluate whether or not it's for the good of medical care and employees, staff that works there.
Okay. So I'll just read it. What do you think makes a committee successful, and how do you envision contributing to that success? A good working committee.
Good work, disagreement.
Disagreement, is that what you said?
And it's a disagreement, feeling free to express your thoughts that possibly something was a good idea or a bad idea, or evaluate what's been done to prepare people for a change, because that's pretty constantly going on in all organizations, not just the medical care. That's one of the main things we do. And as far as it's agreeing with each other, you wanna come to a point where you can agree, or at least say, I have some, some misgivings, but I'm going to go along with what's been presented, because I can't argue with it.
What other questions, Mr. Walker? What about you, Mr. Hardy? Mr. Erickson?
To echo a few of the things that Mrs. Jensen had said, our medical care board is made up of 3. And the chair is appointed by the governor, the other 2 are appointed by the board. The function of that board is to oversee our administrator. And the management of the building is left up to the administrator with the guidance of the board. With all of that being said, Mrs. Jensen, Mr. Van Sickle, Mr. Al Doctor have gone through the COVID period. And this has been the hardest season our medical care has ever gone through. Typically our bed census was running about 100, 110 beds full. At this given point, I think we're around 78 or 80 beds that are full right now. So we've been running at a negative cash flow now for about 3 years. So we have suffered immense losses in our medical care. That being said, staffing has been one of our hardest things, and just as we heard with Life earlier, to fill a bed in the medical care, we have to start right at housekeeping. We have to enjoin dietary. We've got to put in all of our RNs, LPNs, fully staffed, and because of the masking requirements that came from the state, which were beneficial to protect the fragile residents that were in the building, we did suffer losses in the building from COVID deaths. And I know there's been a lot of controversy through these few years as to how to handle this, but with that said, we've had people on both sides of the table. It's been very stressful. It's been meetings that we used to hold up at the MHDHS building on Polk Road. They were full house meetings. We had irate people in the audience. We had police presence.
Mr. Erickson, just to continue though, so we can interview Dr. Jensen, I'll do respect, I totally understand.
But this will preface what Mr. Daines will be also addressing. It's been a difficult position to fill, and the losses that we've suffered in our medical care, hopefully we'll be able to survive.
Yeah, thank you. Do you have any questions for Dr. Jensen?
No, I've known her all my life.
All right. How about you, Mr. Beck?
Also.
Okay, well, thank you, Dr. Jensen, for your time today. All right. All right, Mr. Daines, you're on the hot seat. Don't know how we don't feel that way, though.
He can handle it.
Good morning.
Good morning. So I'll start with the same question I started with Dr. Jensen. What is it that makes you interested in this committee?
Well, I have been employed in the past for 34 years at the medical care facility. Over those years, there's been a lot of changes, both in the facility itself and in the restrictions and requirements of the facility and what is, has to be met. And I think I bring a lot to the table as far as how those changes took place, why they took place, and I think that there's new stuff, I'm sure of, but for the most part, the way it got to be how it is today, I'm familiar with. And both, not just the requirements of taking care of the residents, but also the requirements of the building itself. I was a plant manager for 34 years. I was the housekeeping director for 34 years. I was the laundry director for 34 years. I also had custodial and grounds and maintenance. So totally aware, and I oversaw all the purchasing, with the exception of being control. I have a lot to bring to the table.
But you say that there's been a lot of changes over the years. Maybe give us very briefly what, a couple highlights, ones, that come to mind, and do you think there were good changes, bad changes, or indifferent?
Oh boy, there's a lot. When restraints were outlawed by the state, by the government, they were considered to be, so during that time, you could not have handrails, bed rails anymore. And I actually devised, and one of the biggest issues there was that when a resident went to sit on their bed, the mattress would slide off. So without the side rails, how do you keep them safe? Well, I devised a little thing that went on and it bolted right into the place where the handrail or side rail would bolt. And I had those made in Shelby, but it was what they called a mattress stay, and I devised that. We put it on the beds. It worked great. And when the company came in, called Span America, I showed the rep how we dealt with that issue of mattresses. And lo and behold, here they were. The next time their magazine came out, they were in there for like $45 a set. I didn't get nothing. But anyway, same way with the anti-rollbacks on the chairs. When a resident goes to get up, a lot of times they don't lock their brakes, they forget, whatever, and they have a tendency when they push themselves up, the chair rolls back. I came up with a method of securing the chair. When they go to roll back, it goes over. Same thing there. They started manufacturing that, and they use them on every wheelchair now. There's just been a lot of things like that over the years that, that ingenuity has allowed me to keep the residents safe. And I think that's a big factor, huge factor, is keeping the residents safe.
So now, as Mr. Erickson's saying, this role is it's not an operational role, it's more of a, big picture. You're supporting the administrator of the hospital, or the medical care facility. How are you, what sorts of specific skills and experiences do you bring on that more administrative role, oversight role?
Well,
what benefit it can be?
My viewpoint has always been that the employees know more than the people that do the work on a daily basis, know more about their job than what those of us that sat behind a desk. So I believe that even the board and the administrator need to listen to the employees, and it doesn't necessarily mean that you have to do what they say in all cases, but you should at least consider what they have to say, because most of the time their opinions are good opinions that will help the facility. And like I say, in my 5 departments that I ran, my employees were number one. I mean, Ms. Jensen commented to the fact that we had outside input as far as the cleanliness of the facility. I was that manager for 34 years, and the cleanliness of that facility is not my doing. It was the employees, because I listened to what they said. And every one of my departments, I listened to what my employees said, and I think that's a big factor. Not necessarily let them run it, but give them the opportunity to express and weigh their opinions and implement them if necessary.
How long has it been since you worked there?
Pardon me?
How long has it been since you worked there?
4.5 years.
Okay. So it was before COVID then? So it was just before COVID, pretty much?
Yes.
Okay. Can you share an example of project or initiative where you demonstrate effective collaboration and teamwork? You kind of already hit on that more, but how about more on the administrative level? Oversight level?
I sat on several committees, infection control, safety, chairman of the safety committee for several years. Infection control, safety, I was also on the bargaining committee board, which is another, I think, a big factor, because you learn how things got from point A to point B and why they got there. There's a lot of things in negotiations that came up year after year, but somebody that wasn't there, the longevity of the person that sat on the board, this is why, the reason why that was not approved last time, or this is why we're going to implement that this time. I have managerial experience, not only that, I run my own business. I have for years.
Great. What? I'm monopolizing a little bit. Anybody want to ask a question? How about handling conflict between, like, even maybe your committee, like we talked about with Dr. Jensen, a disagreement as to what direction to go with, you know, in a certain issue? How do you handle that?
Discuss it amongst us and what makes the most sense. You know, I mean, it's and what's the best for the facility. Always the best idea that somebody has is not necessarily the best thing for the residents and for the facility and the progression of the facility to get from point A to point B. And I think that it's very important that we keep the residents' safety and well-being in mind. And to me, that's what we're all there.
So what do you think is the most pressing issue at the medical care facility today? And how would you address it as a committee member?
I absolutely agree that it's lack of being able to hire employees. And I feel as though there's reasons for that need to be addressed. And the employees that are there because they, for the most part, they want the well-being of the residents. They're connected to the residents. It's hard to work in that building and not get connected and feel for people that you don't even know. I mean, you've never met in your life, but they come in as a resident and you do their daily care every day, and you get attached to things. And the nurse aides there have a tremendous job, and their ability to take care of those people and keep them safe and healthy is unbelievable. I could not do their job.
So you said that you think it has to do with, the most pressing issue has to do with staffing and supporting the staffing. What's the solution?
The solution is to listen to them, what their demands are. I don't use the term demands loosely. I don't think that it's a matter of demand. I think it's a matter of wants and needs. And their opinion of how to take care of those residents is priceless compared to somebody sitting behind a table like this who doesn't do it every day. And we need to listen to them. And that's what I would do. I would listen to them. Years ago, we had a board member, well, we had very good board members years ago. Some of you probably remember Marv Wade, Flossie Myers, Larry Van Sickle, from years ago. And that board, they were hands-on, they were in, they came in the facility, they met the residents, and not only the residents, but the staff. And they asked them questions. And quality of care was, we were rated, we still are, I mean, it's rated very highly. Quality of care is tremendous.
Okay, Mr. Banks, do you have any questions you'd like to add?
When you were employed at the care facility, were you a union employee or were you a management?
No, I was managed.
Okay.
I was department head, sure, for all 34 years. I hired him as a department head.
Okay. That's all I had.
How about you, Mr. Hardy?
I'm good.
Mr. Walker?
I'm good, thank you.
Mr. Erickson?
Can you tell us a little bit about our temperature management system?
I can tell you a whole bunch about it, but I'll keep it short as I can. It's a state-of-the-art system that you can actually, like I could control any room if I had somebody call me and say a resident is cold in room 30, get on the computer, bump it up a little bit. You know, this is in the middle of the night, it's not a problem. The statement control system is, you can stop and start pumps, you can stop and start air handler, you can do air conditioning, you can do everything sitting behind your desk or from home remotely. And that's a big plus for a facility like that. I mean, it's because like the well-being of those residents. I used to get criticized when I would go out of town with my buddy's snowmobile, and I'm on my phone changing the temperatures in rooms because they called me and said such and such a room is cold. You know, you're on vacation. Well, their well-being is more important to me than this extra 5 minutes that it takes me. But yes, that state-of-the-art system is respectful.
Okay, I don't have any other questions either, so thank you, Mr. Daines, for coming here and being here. So you can be excused. You can be excused, appreciate it.
All right, thank you.
Thank you.
Thank you.
All right. Department head reports for personnel and health and human services. All right, public comment. All right, I'll adjourn the meeting, the personnel and health and human services committee meeting. Can I take a quick break?
Yes. Good.
Thank you, Paul.
Yep.
Did we say we were taking a little break?
Is that a written rule or an unwritten rule?
I'm trying, it was written at one time.
Yeah?
Thing.
I'm looking at this guy, he was staring at the cop.
Staring at or something.
You scared something, I'll tell you.
Yeah.
We generally stay and listen to
You can, if you've got other things to do, it's not that big a deal. We've got another committee to go through, and then we'll vote on this question at our 11:30 meeting, so.
yeah, I've got some obligations.
Yep. No offense if you've gotta deal with those, so, yep,
So
11 o'clock now, but we could go later than 11:30 with our next committee, so.
well,
talk.
It's gonna be a while.
It's gonna be a while, and I'm supposed to be filling out forms for the pastor at church, she's waiting for me, so.
Oh,
I
Yep.
think I should go.
that'll be fine.
He's coming.
Are you responsible for that?
You know, I'm trying to think.
I wanna know who
That was
did
a,
that.
that was a ghost.
That was really cool.
I think what happened was somebody put it in and it slid in on one side, not all the way in the other.
Yeah, your excuses.
Well,
You
this,
did that to jerk me up.
maybe it broke the, you know, the
Boy,
tension
she's
system.
getting
The
better.
tension,
Mhm.
the
Scary.
tension,
Yeah, the
okay.
tension.
She's had some real issues too.
Yeah.
Larry put her into this
Well,
again.
again, I'm sure you guys know how to get a hold
He
of me.
just does
I'm
not
supposed to
like
be at
it.
church for the last-
It's all personal.
That's too bad.
I've got 4 hours or 4 hours.
Oh my,
I don't wanna do this.
yeah.
I saw that picture of your mama.
Hi, Amanda.
She looks great.
Good to see you.
She's doing good.
You like your new role in the Ocean Echo? Well, it's the same, similar role you did before, but.
She's good.
Yeah.
I hate to say it, I got my renewal notice for the Journal, and I'm like, don't I really need this anymore?
Yeah.
Sorry.
Yeah. I know, that's a tough one. I just renewed it, but just, you know. So I do want to support them too.
John, how long until you retire?
When the day's right.
Yeah? Well, you might be the only reason I renew.
Okay.
So,
There's no date on it.
no?
Not yet.
You're not like most state troopers that I meet. They're 10 days into the job and they already know their retirement date down to the minute.
Then they get a real estate job.
We'll get you some more.
All right, thanks. Yeah, I'm still tired of this.
Yeah, I get it.
Yeah, yeah.
Yeah.
Been there for a while, Phil?
Well, it's, yeah, the last 6 weeks, it's here and there, you know, comes back.
Oh, man.
Probably allergies, but, you know.
Well, that's right. Could be just allergic to cold weather.
Right. Or to work. No.
Well, yeah, that's true too. You're both.
Craig's allergic to both. That's why he's heading to Florida soon.
That's right.
Yeah, you got, our next meeting is another 4 weeks, right? 5 weeks?
Yes. And unfortunately, I'm gonna miss a.
Oh, you are?
It's the first
Well, when they
Thursday in
published the
December.
Meeting schedule, it was incorrect, so
Oh.
I made the plane reservation, so I come in at 11
Oh, I
in
see.
December, which is gonna miss it.
So yeah, it's 4 weeks, even though it's the first Thursday in December.
And I checked on changing it, and I don't wanna change it. Anything in December, Christmas is pricey, and it's just. But I will be here for the second December meeting.
Yep.
I've been excused by the chair, so.
It's not running too bad right now, I think.
All right.
Take a bribe.
Go home and get you some soup.
I'll get you.
Real juice. Not that fake stuff.
Just stay over there.
Right.
Pretty easy.
I think it's allergies.
No thanks.
That's not the way my dad raised me. You know.
Yep.
All right. Okay, I'd like to call to order the Finance and Administration Committee. May we have a roll call, please?
Mr. Erickson?
Here.
Mr. Morris?
Here.
Mr. Beggs?
Here.
Mr. Walker?
Here.
Mr. Hardy?
Here. I'd ask for a motion for the approval of the meeting minutes from October 26th.
So moved, Walker.
By Walker, supported by Erickson.
Yes.
All right,
Thank you. All in favor, aye?
Aye.
Opposed, same. Motion carried. Are there any changes to the agenda?
I would like to add a conversation about the building fund, if I may.
I'm sorry, you wanna add
A conversation about the building department, fund, the report.
You're talking about the building improvement fund?
No,
The building
the
department?
building department,
Okay.
that we got in the supplemental packet. The building department.
Oh, okay, gotcha. The report,
Yeah, the report. yeah.
okay.
All right, do we wanna put that, where would you like that, Mr. Morris?
It can be at the very end,
Very
or
end,
wherever.
just put it in front of the department head report.
Okay.
All right. Any other changes to the agenda? I'd ask for a motion to approve the modified agenda.
I'll make a motion to approve the modified agenda.
so support Walker.
Motion by Gregg, support by Walker. All in favor, aye?
Aye.
Opposed, same. Motion carried. Is there any public comment at this time for Finance and Administration Committee? Hearing none, we will move on. Mr. Gerard, consideration to adopt hard caps for the county insurance, 2023-120.
Each year you are required to adopt, hard caps 80/20, as a result of the, Public Act, with regards to health insurance, and I'm asking that the board considers, adoption of the hard caps again for 2024.
Any comments, questions?
Yeah, I do.
Mr. Morris?
So what's the hard number for the cap?
I'd have to pull up we get a notification from the state of Michigan that tells us that anything over the hard caps that we receive, the county can pay up to that point, but anything above that, the employee is responsible for that amount. I'd have to pull that amount up for you, but as I stated previously, currently, right now, a full family is paying $16.49 per pay for the 250-500 Blue Care Network plan, and that is going to, I believe it is $84 per pay. So,
So if it goes up, what they anticipate the hard cap number to be, it's gonna probably then raise up that much, raise their.
anything above that hard cap and what our rates come in as, is what determines what the employees will be paid.
Yep, thanks.
Any other questions?
Another thing that sounds real simple, it's not simple at all.
No, that's not. Okay, Ms. Beard, consideration to revise the public hearing motion for the proposed fiscal year 2024 budget and property tax millage rate to be levied from November 9th to December 17th.
So again, I'm asking that the board revise the public hearing again because, we had turned the notification into the paper. They sent us, what it would look like in the paper, and lo and behold, it didn't make it in. So, they apologized for that. I have already gotten her the revision. They've sent us
The proof?
the proof, and she says she has it on her calendar for the week prior to make sure that it's going to be in there. And I explained to her that we only have 2 more shots at this. The board has to have this posted in the paper, and the public hearing must happen in order for us to adopt our budget. So, she stated that it will be in the paper.
Mr. Hardy,
Yes.
may I? When the administrator reached out to me, as we all know, this is not the first time we've been through this, when we had something on the agenda, I suggested to our administrator that she call the publisher of the 3 papers and express my dissatisfaction with these not going in, and how it's very difficult for us to do business this way. And I believe that she got in touch with the person head of that department, and we were assured that it wouldn't happen. Because if it would happen again, we would have to call a special meeting to adopt the budget.
Right.
And we don't have any options.
We have
We have one option,
The
that's right now.
only option that we would have is to call a special meeting. And that has to be published, and then that special meeting has to be published in the paper.
You're saying a second source to publish.
Yeah.
We don't have that option yet.
Keyword yet.
Yeah.
And I even reached out to the county attorney and asked if there were any other options for us, because, that paper needs to be established for a certain period of time, and even asked about possibly the Ludington Press, you know, and
Ludington Daily News.
Yeah, Ludington Daily News, and getting it in there because it circulates in Oceana County, and he said no, because we have a paper here in the county. So, it might behoove us to discuss, this issue with our legislators, because I know the Open Meetings Act was a, item that was discussed previously, and, talk to them about possible changes to, for issues that arise such as this.
I think that ultimately there is going to be a change, because the published media is not what it used to be. Anybody who picks up a Sunday Muskegon Chronicle anymore will realize that it's about the size of the Oceana Herald Journal there, and it's a changing times that we're coming. And I think the legislature, you're exactly correct, is the only one who can address it.
Right.
You know, I don't know what the answer is, because I'm not very knowledgeable about social medias and other medias, but I know that it's not working for a lot of units of government now. They have a paper of general circulation.
Right.
To deal with.
Something will have to change.
It's gonna have to change.
Mr. Hardy.
Yes.
Yes, and I also might add, in this conundrum we're in with this publication, this free paper that Amanda's here right now today, we have a circulation right now of 10,000 weekly free versus a paid publication, which is a subscription basis or purchases at a newsstand. And in the coming weeks, we will be adding the Rothbury and Montague zip codes. We'll be adding another 4,000 in circulation. So within 2 weeks, we will cover the entire county with 14,000 weekly issues. And I've been on the phone with Mr. Bumstead, I've been on the phone with Mr. Vanderwall, we've spoken with the Michigan Press Association, and we're trying to get a fast track so that we can be that newspaper of general circulation that can handle these notices. It's not easy, but we're on the right trail right now to be that paper where if it's free in your mailbox every single Friday morning, you're getting the notice. You don't have to buy a paper or a subscription. And print is tough, but we've got cartoons.
Great. Thank you.
So what is the time frame to be a paper of general circulation?
My understanding is 12 months, but when I spoke with Mr. Bumstead, he explained to me that, you know, with the changing times in social media and everybody's online now, there's been a movement to take these public notices away from the printed product to go to something else, but we have a large population that's not involved in social media. So there is a very tough road to hoe as to what needs to be in a public notice and how does the public get that notice. And 100 years ago, you had to run to the town hall or the courthouse and you had to look at what was taped or tacked on the wall. And then you had to, you know, by hook or crook, get the news out for people to show up at the meeting. But now, you know, telephones helped, but social media and the internet is where we're headed.
Hopefully we'll be able to pass the budget next meeting.
Greg, I don't wanna see us have to move away from a local paper or anything. I appreciate the local paper, I read it all the time, but it's very difficult when we are boxed in the corners like this. You know, and it's tough. And
All right, Administrator Biard, consideration of Oceana MDHHS budget request for the social welfare fiscal year 2024.
This was a request that had come into, the office with regards to a, proposal, budget request, from, it had evidently been taken out of the budget, back in 2008, and they're requesting that, the $8,000 be put back into the budget. I provided a copy of their letter, and, they're requesting reinstatement of those funds.
Any questions? Ms. Wall?
I thought that was taken out of the budget the first year that I was on the board. So it's been at least that long, you know, but at 2008, maybe a little bit early. And it was taken out because the medical care facility has their own budget and health and human resources, you know, for training and for traveling and for that. And that's why it was taken out of the budget. I guess from my standpoint, I haven't seen a big reason to put that back in the budget again. We've been asked several times, you know, in my tenure on the board, and I haven't seen a real good specific reason on why we should put that back in again. This is a very prudent board on financing, and we're very careful where we spend our money. And I just, if the board so wishes, I could go along with it, but I just am not so sure that.
Any other questions or comments?
But just reading through the list of what they say this $8,000 supports, it's a pretty long list for a pretty small dollar amount. I don't see great need, in my opinion.
It's the fine shot effect.
Yeah.
Anyone else?
With that said, I will qualify that I do believe that foster care and adoption are very important causes, but I'll leave it at that.
It's not that they're not funded at all at this time.
Correct.
My question is more rhetorical. So they have not done as quality of a job as they could have if we were to give them $8,000 last year and the year before and the year before, or is this just probably pad? The budget's probably not the right term, but I'll just say it, you know. And I would say I agree with Mr. Walker and Mr. Begg that I don't love. When I read that, I was like, man, I can't see us going for it. I mean, was it $250,000, $60,000, $70,000 we already give to them? Isn't it?
Yeah,
Something like that. Anyway, it's over $200,000.
Yeah.
So is that $8,000 gonna make that difference? I just don't see it as doing that. I do foster care, total support of foster care as well. That was the one thing that stood out to me where I was like, oh, that's the only thing that made me hesitate.
but they have their own budget as well.
I would, may I?
Yes, please.
If there was a special project that this board was working on, and during the year they came to us and said, we have this special project and we wanna work on, it's gonna cost us $3,000 to do this special project. Let's look at our fund revenue and look at it and you know, and designate money for those special specific projects instead of a whole shopping list of projects. I'd feel more comfortable doing that myself.
The reason that you've got this request Sitting in that meeting, we meet monthly, that $8,000 had been used for dues, subscriptions, things of that nature. Janet did identify a few more things, but those expenses are paid out of the medical care facilities budget. And the medical care facilities budget has been under tremendous pressure these last few years, wherein Mr. Van Sickle had requested that this funding come back from the county because of the pressure that's been in a losing situation at the medical care. So that was the big basis here. It was a dues bill that came in that will be paid by the medical care. But they had hoped to get a budget back as it had been in light of the massive losses we're suffering at the medical care to take money out of that budget. And you got to look at all the money that we've gotten, $5.3 million in ARPA money. What's $8,000?
Well, my response would be, if I may, my response would be, it's gonna be 8,000 every year. It's not gonna end up being, you know how that gets embedded into your, into your budget. So it's gonna be 8,000 this year, then next year, and then, so it's gonna be not just 8,000. It's not a one-time thing, right? It's not a one-time request, from what I understand. It is a one-time request.
No, I believe they're wanting it reinstated into.
I get that. I didn't realize that though. That's good background about the medical care facility, that it would now not come out of their budget.
What's the annual budget for the medical care facility? Is it close to $20 million? $11 million?
11.
Mind your business. Find your own $8,000. That's, if you want my opinion.
Well, we're county-owned medical care.
I understand.
And it has its own set of issues. But if we can't increase our bed census, I don't want to be selling our medical care. So we need to do everything we can right now to keep our medical care. And we need to raise our bed census, and we need to get back in the black.
Yes, Mr.
Finally, I'm not disagreeing with that at all, Paul, and I'm not disagreeing with it all, but when the departments come in and submit their budget to the county administrator, who tabulates them in her office, who brings the budget proposals to us, and we spend all day and then we come back again and go over them. There are specific line items for each thing in each department that we go over. And I feel as though if they have a specific item that they want to bring to us and want us to fund on a specific item, on an annual basis, that I would be more comfortable than just, donating the money to use for whatever comes up, or whatever they want. I'm more of the thought, I don't want to shut the door totally, but I think I would rather myself look at the specific requests that they have. My personal
I thoroughly
opinion.
understand, and if that were understood, that might be the way that we'll end up addressing that in the future.
Thank you. Ms. Biard, Administrator's review of selected claims for payment, and I'll go down to Administrator's report as well.
Okay. So, the list of claims have been provided for you. Are there any questions on those? Okay, and next, the administrator's report. I provided a copy of the report in your packet. In addition to that, I just wanted to give you an update on the meeting that I had with Lake Mason. Chris Wren from Newaygo was not able to attend, and Muskegon County, we met to discuss the materials management plan. We did receive a quote from Wimserdeck, but Chris Wren from Newaygo did offer to do a request for a proposal, just so we can put this materials management plan out for bid, and get a good idea of what organizations that actually deal with materials management planning would do the job for, and then we will meet again and discuss what avenue we think would be best to take to our boards. They haven't finalized the materials management planning through Eagle yet, so we're really, kind of in limbo with that right now, but I will keep you posted as that comes along.
Thank you. Any questions?
Not on that, but to our previous conversation about, can I comment one more?
Sure.
So I just pulled up the fund budget proposed for 2024, and medical care facility has an estimated revenue of $17 million, and estimated expenses of total appropriations of $19 million, $19.5 million, with a fund balance of $3.5 million. And I guess I'm a little irritated we're being asked for another $8,000.
Taken. Mr. Morris, you wanted to add a conversation on the building fund, was it?
Yeah, so, if you look at the building department report, the fund balance, sorry, got a cold, it's hard to talk for some reason, keeps on rising. And I just wonder, what do we need that much in there for? When the four of us started our tenure, Mr. Walker was still, on the board, or his re-ups. There was $225,000 at the end of 2022, was the fund balance for the building department. Now it's $429,000. So in less than 3 years, it's gone up by over $200,000, almost doubled in fund balance. A reserve is good, very good, I like that. But I would say, I think that this is more than a reserve for a fund this is basically an in and out fund, correct? Permit fees come in, and then those permit fees pay Story and Newman and all those guys. Is that correct? It's basically in and out. I know we have our leaner years on building and all that. So, we have a challenge as far as housing goes. We need, 1,400 houses, and we're that many houses short, according to that report, that housing assessment. And we have, I look as an opportunity, a surplus in our building department. I would propose that we do something out of the box. That we reduce the cost of permits, maybe like in half. Just temporarily, as maybe a pilot of some sort. Maybe like the first 100 for 2024. So 100 mechanical, 100 electrical, and so forth. Reduce them in half or 3/4, whatever, just reduce them at a certain rate. Or something similar, while still paying the building department employees the same. What I like about this is developers, they want to see local governments buy in. They want to see that we are on board with them, that they come to our county, come to our area. So if it does in fact draw interest and action from developers, then we have increased the tax base with opportunities to cover the needs of our departments, and maybe my goal overall too is to lower the tax rate. I see this as a low-risk way of helping with the housing challenge. It's addressing the housing challenge. It potentially will, potentially attracting developers with this idea that I'm certain other counties have not even considered, and then growing our tax base. I see this as a win-win. And the funds are there. So that's my spiel.
Yes, Mr. Walker.
Having spent 21 years in the building industry, and having worked on both sides of this, don't take offense to this. Changing our building permits fees is not gonna affect the amount of permits pulled, period. It's the lending institutions. They will not loan any money to people to build houses on construction loans. I told the board before how it took my son with an 840 credit rating couldn't get a loan to build a house.
Right.
Couldn't get a loan because the banks don't wanna loan money. And then if they do loan money, they will only allow you to have 5 draws to pay the suppliers. That means the suppliers are gonna have to hold paper for 60 or 90 days before they get their money. It's the lending institutions, number one. I'm gonna back up to when I first came on the board. When I first came on the board, just before I came on the board, the inspectors were all county employees. And we were funding that department to the tune of $140,000 to $150,000 a year, just to keep them on float. That was in the good years, when there was a lot of things going on. In 2008, when the building went flat, it flattened right out. It was more than that we were funding. So the board went to contractual employees for our inspectors, who are paid a percentage of the fees. And if you look at the last 2 years, and you look at the construction that's been done in the last 2 years, and the cost that were paid on permits, when we have 8,000 square foot houses being built on Lake Michigan, those people are paying so much money for those permits. And that's where that revenue has increased, that fund balance has come up, because those are being built all the time. If we get into a stale economy and stale building like we had in 2008, that fund revenue is gonna go down, it's gonna plummet. And we still need to keep our inspectors here. One of the people I worked with at Standard Lumber is an inspector in Norton Shores now. The same house for the building, the same house that I'm building right now, for the building permit only, not the plumbing and not the electrical. That permit was $840 in Oceana County. In Norton Shores, it was $2,300 for the same square foot house. Our permits in Oceana County are not out of line on what the cost is. And I'm just cautious about dropping them down, because where I'm building right now is right on Oceana Drive or Michigan Avenue in Rothbury. In the last week, I've had 5 drywallers stop and ask if they could give me a price on drywalling, because they have no work right now. The building industry is starting to slow down. And part of the building industry is starting to slow down because the banks, they will loan money if there are houses to buy, but they do not want to loan money on construction loans anymore. And, you know, a builder, these people that are building these multi-thousand square foot houses that take 4 and 5 years to build, they can't finish one of those houses and walk into a bank a year later and try to work with a customer to do a construction for them on a construction loan, because they haven't built 3 houses in the last 2 years. The banks, the title insurance companies, that's their regulations now. If you haven't built 3 houses in the last 2 years, you may have built a $10 million house on Lake Michigan. It took 4 years to build, but you don't qualify to do another one until you've done 3 of them.
So, if I may, so my response would be, yeah, totally understand the banks they need to change some practices, and they have a lot to do with that. I'm just looking at, so if we're looking, you know, like I said, as supporting development, I think that this, even though, I mean, it would, you know, cut things in half from $840 in your son's house case to $400. That's just you know, that's a pilot. It's just, remember, this is not long-term. This is just a trial thing. Would that be enough to attract? I don't know. I don't know, you know, with them building in Oceana County versus Muskegon County, but maybe. And we have such a need for houses here. I just trying to figure out a way, and we have such a surplus that just trying to figure out a way that maybe we could, you know, be part of that.
I think maybe what we should do, if you want to investigate a little bit further, is it might be prudent to talk to the head, Mr. Miller, and find out what they anticipate or what they see in the future. Because because I agree with Mr. Walker that like the 2008 downturn, that can create a pretty big hole off fast. And it kind of looks like it's that way right now. I mean, when you look at the number of permits being pulled and everything. And I know some of that increase was also due to the fees they charge for the plan reviews and things like that, because building costs went up, 30%. So those fees indirectly, increased as well, because they were based on the cost of the construction itself. But I think maybe a place to start is to talk with Mr. Miller and just see what they foresee, and maybe take a look at it again.
We have drawn in the past out of that fund revenue. When we ran into problems with the people in when our employee retired out of that department after being there 30-some years, we used that fund revenue to pay off, for accrued benefits.
Her retirement, yes, but her retirement now, because she was on the DB plan, is being paid out of that fund now. And we've also started taking, indirect costs out of there. So, we have a cost allocation plan that is done by MGT, which determines, any work that is done by accounts payable or payroll or our health and, or our, human resources, or work that I do as it relates to that department. And we're able to charge back to that department to help fund some of those.
When did that start?
Lastly, Phil,
This year.
I'm glad you're looking at things like this, but lastly, I'm no more in favor of doing this than I was in favor of giving a discount for a big track builder or a big development coming in. I spoke very, very much against that when we had that come before us, and because I don't know where you begin and where you end with that. What, do you say that we will give a discount in the building permits for any individual building a house less than 1,200 square feet? We're gonna get yelled at by the people that are paying multi-thousands of dollars from them, and I don't know where there's a compromise for those.
Yes, Mr. Erickson.
Yeah, and Mr. Morris, I started lending money in Hart 40 years ago on mortgages, did a lot of construction loans. And we were working with an economy that was headed upwards of 17% on certificates of deposit. Right now, with the current cost per foot on housing, upwards over $200 a foot. I don't think that the permits are going to stop anyone from building a house in this market right now. We'll be fortunate if people do have new building starts. And if we can draw upon that fund, it's not like it's sitting there not doing anything. It's something that we'll have to go in the future. But with the project in Shelby Acres, and how we went through that permitting process, and then the Petersons turn that money back to us at this given point in time, I think we're going to have to ride it out. Mortgage rates are on the way up. Tough times are coming. I don't think we're going to have the starts unless they're the multi-thousand square foot houses where the building permit will have no effect on that house going up.
Unless you have a Pulte or United Homes, which are from the southeast part of the United States, and they do 4,000 to 5,000 or more homes a year. Until somebody comes in with the track houses like they built after World War II, that's where it's going to. This is about as complex as some of these other regulations we get from the state on how they actually work out. There's so many phases to it.
And so, the per number of permits in October was 272 that were filed for. It's 299 in October 23.